Moderate sedation, sometimes called conscious sedation, also procedural sedation, is a type of anesthesia that is used when complete loss of consciousness isn't necessary. Um, Moderate sedation is used for minor surgical procedures, for diagnostic procedures like, for example, endoscopic procedures, colonoscopies, and so on. Procedures that don't last very long and that don't require anesthesia to the same depth that procedures requiring full-on general anesthesia require. So the other piece of moderate sedation, and I mentioned this in another video, uh, patients who are being given moderate sedation need to remain not alert, but they need not to be in such a deep state of unconsciousness that they can't keep their own airway open. So they need to be able to continue to breathe. We don't want any respiratory depression. And so the medications, the anesthetic agents that are used for moderate sedation cause a lighter level of anesthesia, not a really deep anesthesia. The patient relaxes. There are anti-anxiety effects, maybe some amnesia, although the drugs that are used for moderate sedation, we can't guarantee that the patient isn't going to remember the procedure, and reduce sensitivity to pain. But they're still awake enough to respond to verbal commands. Very interesting. If in fact the drug is able to bring about amnesia, then they're not going to remember being awake, but and not going to remember being able to respond to verbal commands. But it's a halfway point, I guess you might say, between just using a local anesthetic and using general anesthesia. So what drugs are used for moderate sedation? Well, we've learned that propofol can be used for moderate sedation. We've learned that the dexmedetomidine or Precedex can be used for moderate sedation, and they can be used alone. Midazolam, a short-acting benzodiazepine, may be used for moderate sedation, and they are often combined with some sort of an opioid like fentanyl, which will give greater analgesia during the procedure. All the drugs that are listed here, midazolam, propofol, the Precedex, these are short-acting drugs, so that the onset of the sedation is fairly rapid, but they will recover from the sedation also fairly rapidly. And these drugs are in general safer to use. Moderate sedation can be given by registered nurses who are not nurse anesthetists in some settings. Moderate sedation may be used for office procedures or in ambulatory surgical centers and so on. Your textbook points out that the more surgical procedures are streamlined to become shorter or to be given in outpatient settings, the more use there's going to be found for moderate sedation. Last comment here, in the state of California, RNs are allowed to administer conscious sedation. So this is you in your nursing practice may deliver these rapid acting drugs to lightly anesthetize somebody, sedate them in order to permit completion of minor surgical procedures or diagnostic procedures.